Good evening to our viewers in the West, and thank you for joining us on a busy Friday night. We're going to begin with breaking news on the nation's only single-dose coronavirus vaccine. Tonight, the CDC and FDA have lifted the pause on Johnson & Johnson's COVID shot, saying they have confidence that it is safe and effective for all Americans over the age of 18. The decision comes 10 days after the FDA told states to stop giving the vaccine because several women had developed a rare and dangerous type of blood clot. Well, since then, the CDC has found 15 cases of the unusual disorder, all in women, but an advisory panel said today the risk of clotting from the vaccine is extremely low and that making it available again would save hundreds of lives. Tonight, Johnson & Johnson and the FDA say they've agreed on a fact sheet designed to alert people getting the shot about the risks of the rare disorder, especially in women under age 50. And as we come on the air, some states, including Texas, say they're already planning to order more doses as soon as tomorrow. But across the country, experts say they are concerned about whether Americans will be willing to get the shot or will be scared off. Our chief medical correspondent, Dr. John LaPook, is standing by to answer your questions about the vaccine. But first, CBS's Nikki Battiste is going to lead off our coverage from New York. Good evening, Nikki.
Nora, good evening. In New York, anyone 16 and over who wants a shot can get a shot. And officials are hoping the chance to be vaccinated here inside the American Museum of Natural History will convince more people to show up, especially those hesitant after a pause in the Johnson & Johnson vaccine. Tonight, the CDC and FDA lifted the pause after an advisory committee recommended the Johnson & Johnson shot rejoin the mix of COVID-fighting vaccines. But unlike the Pfizer and Moderna shots, J&J's will likely come with a warning about the potential risk of rare but highly dangerous brain blood clot.
Together, both agencies have full confidence that this vaccine's known and potential benefits outweigh its known and potential risks.
The committee concluded the benefits of getting the shot outweigh the possible risks, pointing out that as many as 45 adults could suffer a clot, but up to 1,400 lives might be saved. Tonight's vote comes just 10 days after the CDC suggested pulling the vaccine to investigate 6 cases of clots in premenopausal women.
This pause was essential to our ability to inform the public.
We're also learning tonight of 9 more potential cases, all in women. 3 have died, 7 remain hospitalized. Within 3 weeks of getting vaccinated, initial symptoms included head and body aches, fever, and chills. The brain blood clots are extremely rare. The CDC noted the risk was less than 2 cases per 1 million vaccine doses administered.
I think too many people may be scared off by taking the vaccine.
Health officials worry about vaccine hesitancy. Demand for shots continues to drop in some states.
All right, go to the right.
Unfortunately, everything plays into vaccine hesitancy these days.
A decision potentially puts about 10 million doses back into the pipeline.
And I am here at our large-scale vaccination clinic. And as you can see, we have lots of empty chairs.
Catherine Wells says the health department in Lubbock, Texas, has 7,500 vials already stored in this refrigerator.
If they allow us to use that, we will get that moving and get them into people's arms, because much more effective to be in an arm than in my refrigerator.
But there are other woes for J&J. Officials are still investigating contamination at J&J's Baltimore plant, operated by Emergent, forcing it to shut down. The Biden administration says there are enough Pfizer and Moderna vaccines for all Americans who want one. Moderna said today it's working to have a booster shot against COVID-19 variants by early fall if it's needed. Nora?
Nikki Battiste, thank you.